The NHIS Act and the operational guidelines are two important documents guiding the implementation of the National Health Insurance Scheme. They stipulate what should be done to give Nigerians access to quality healthcare services and how it should be done. Sometimes, there are violations which can distress stakeholders and hinder the achievement of the objectives of the scheme. When this happens, the scheme has a way of enforcing its provisions and restore the values of the NHIS. And that is what we shall be looking at in this episode of Easy Access to Healthcare for All. NHIS Redress Mechanism, Enforcement and the Gains from it. My name is Hussaina Amina Aboki, your host. Do stay tuned for the details after this timeout. First on the program is a highlight of news events around the NHIS. In our lineup, NIGCOMSAT boss hails NHIS digital platform. Details shortly.
Easy access to quality healthcare for all. NHIS.
The National Health Insurance Scheme and the Africa Health Budget Network have signed a Memorandum of Understanding to support the NHIS in the development of accountability framework, in line with the NHIS 10-year strategic plan. Before the signing, the Chief Executive Officer of the Africa Health Budget Network, Dr. Aminu Magashi Garba, had said part of the aim of the MOU is to spread more awareness to the public on what the NHIS as an agency does.
Whenever you talk about NHIS, there is kind of a switch off of information. So a lot of NGOs are engaging MPSCDA very well. They are engaging NCDC. They are engaging the Federal Minister of Health. But whenever it comes to the NHIS, you don't hear much regarding the civil society engagement. And the only thing people likely know is they are disbursing funds to HMOs. So that's the usual response. So we are hoping that part of this MOU is to change that narrative of flow of information between the NHIS and the Nigerians through the media and the civil society. You are doing a lot of things beyond disposing money to HMOs. And Nigerians need to know what you are doing and also how they can help you to achieve your goals and the vision of the NHIS.
Dr. Magashi further said the Africa Health Budget Network also helps to work with the NHIS in the implementation of the NHIS 10-year strategic plan. While responding, the Executive Secretary of the NHIS, Professor Muhammad Nasir Sambu, who was represented by Mrs. Blessing Nyengi, the head legal of the NHIS, expressed appreciation to the Africa Health Budget Network for presenting itself to support the NHIS.
The National Health Insurance Scheme is an agency of government that is mandated to provide health care to all Nigerians, like you know. And of course, we know that that task is not an easy one, it's enormous, and it is uphill. And we need people to collaborate with us, people to partner with us, people to support us. And today your agency has presented itself to do so. So we are grateful.
The NHIS infrastructure put in place by the National Health Insurance Scheme will not only aid the seamless implementation of the objectives of the scheme, but also help the database that can drive a digital economy. This much was said by the Managing Director and Chief Executive Officer of NIGCOMSAT, Abimbola Alale. She was speaking after touring the ICT infrastructure put in place for the NHIS project alongside the Minister of Health and other stakeholders.
And you know, data today is the new oil. Data is critical. Data, and even though it is, it seems like just ordinary information, but data is what drives economy. So other than this center take care of health data, this center can also be used. The data hosted here can be used for national development and imperative for digital economy.
NHIS partners the NHIS as project coordinator and implementer of the NHIS project. The NHIS CEO, while speaking of the standards and quality adopted in establishing the center, also spoke of the various sectors of the economy that the NHIS database can serve.
NHIS is having this massive national data center. Even though it's taking care of health, but we now discover that beyond health, it's a great asset for us in Nigeria. The data can be extracted to plan for our people. And we know that when you're talking of data, you're talking of security. This center is an ISO standard, that's International Standard Organization standard data center. There's everything about information security is in place.
The NHIS project is a product of several years of planning being brought to fruition through the relentless efforts of the new NHIS management with the support of the Federal Executive Council.
The program is easy access to healthcare for all. When a patient is an enrollee of the NHIS and needs medical attention but cannot get it, what does he do? Or when a healthcare provider has issues with the health maintenance organization and vice versa, who settles the matter and how? Or what does the NHIS do when it discovers that its operational guidelines are not being adhered to? These are important questions that are answered in our next segment, Issues around the NHIS, as we look at the NHIS redress mechanism.
Easy access to quality healthcare for all. NHIS.
The National Health Insurance Scheme was established to give Nigerians easy access to healthcare without having to worry about out-of-pocket expenses. Enrollees who have benefited from the scheme continually laud the initiative, describing it as very helpful. In bringing this healthcare to the enrollees, a number of stakeholders are involved in a carefully interwoven system. The NHIS acts as regulator of the scheme. It accredits health maintenance organizations who implement and manage the scheme, acting as the middleman between the NHIS and the enrollee. The NHIS also accredits healthcare providers who provide the much-needed healthcare services to the enrollees. All of these activities are guided by the NHIS Act as well as the operational guidelines of the scheme, so that the NHIS can achieve its goal of giving healthcare to Nigerians. To further ensure that things work according to design, the NHIS set up the Enforcement Department.
The mandate is to ensure that the provisions of the operational guideline and the NHIS Act are being strictly adhered to by all the stakeholders of the scheme. And this is in a drive that is for the scheme, in a drive for the scheme that is to attain its own objectives.
The major activities carried out by the NHIS Enforcement Department are in three key areas: complaint handling, compliance, monitoring and assessment, dispute resolution. How does the department handle complaints?
When the complaint comes, we now receive the complaint, we document the complaint, now we investigate that complaint, and after investigation, we now carry out resolution. And we do the resolution of the complaint. What we find out during our investigation, we compare it to what is in the book of the NHIS, which is the NHIS law, and then the NHIS operational guideline. If we find out that there's any infraction, then we now, what we do now, we now provide and then also suggest for what type of sanction that can be applied.
Compliance monitoring and assessment is a preventive action to guard against stakeholders, especially HMOs and HCPs, from erring against the guidelines. The NHIS, through the Enforcement Department, routinely carries out monitoring of key indicators within the operations of stakeholders to check for deviations, risk measurement in case of deviations, and eventually enforcement activities. Dispute resolution is one aspect that has been given great attention by the NHIS in recent times. The NHIS had cause to institute a reconciliation exercise between HMOs and HCPs to resolve issues of indebtedness. How did this happen, and what has been gained from this reconciliation exercise?
Over time, now we start seeing one form of trend whereby there is a violation of a particular provision of the claim processing aspect of the scheme. The healthcare facilities will not submit their bill in good time after they offer treatment at the secondary or tertiary level. The HMO is not even tracking what we call the authorization, because that is a permission that he has granted for them to be treated at the secondary level. He will also sit down. But he failed to realize that whatever code he has given, it will translate into monetary aspect, a claim that may likely come. So you find out that over time, this thing become very cumulative. And it reached a limit whereby it is trying to affect the service provision at that particular levels. Therefore, NHIS now have to step in. And it has to step in quickly and in a very strong way to be able to carry out that particular exercise called reconciliation, where we now collect all the alleged indebtedness, because we still call it as an allegation. If you are complaining that this particular HMO is on you, we call it what's called as just an allegation. So you submit. When you submit, we pass over that allegation to the HMO. And then we now bring all the two parties to come to the NHIS office, which in this case, that exercise was conducted in all the 38 state offices of the NHIS.
The reconciliation exercise has been quite successful, so much so that for the period spanning 2016 to 2019, over 2.3 billion naira has been recovered from HMOs to healthcare facilities. The reconciliation has now expanded to cover the periods between 2020 and 2021 and is currently ongoing.
The current management at NHIS considered reconciliation as a strategy for confidence building, so that there won't be any rancor between HMOs and healthcare facilities. And I think by and large, they have succeeded, and because right now, whatever is due to providers is promptly remitted, and if there are any unremitted funds, then they are remitted back to the NHIS.
One other tool that the Enforcement Department has employed and has yielded results is the redress mechanism that gives the enrollee the opportunity to seek redress. The NHIS has 38 state offices across Nigeria that are equipped to take complaints of enrollees and healthcare providers. And if it is the HMO that has a complaint against an enrollee of a healthcare facility, the HMO would report to the NHIS directly. The kinds of complaints that the NHIS receives vary. They include reports of fraudulent activities where healthcare facilities file claims for procedures not carried out, allegations of non-payment to hospitals by HMOs, and even impersonation by enrollees who want to present non-relatives as dependents. Upon receipt of a complaint, how does the NHIS go about resolving the issues?
Once we pick this, then we now look at the case, and if there's a one we direct it back to the state to carry out initial investigation. After they do their initial investigation, they will come up with the outcome. And then now we compare with what we said. If there is any infraction being detected, they also advise accordingly on what should be done on that particular issue. If there is a sanction, they will recommend what sanction. And if there is no sanction, they will resolve the issue. Everybody will be happy. then they will submit the report to the head office.
The redress mechanism of the NHIS, alongside other activities of the Enforcement Department, have yielded a lot of gains both for stakeholders and the NHIS.
With these processes now, we are getting confidence. Now, there is a confidence from the stakeholders on the regulatory aspect of the scheme. As we know, part of what we call almost all regulatory bodies, they must need to have an efficient way in which they handle complaint and grievance from their stakeholders. Once we find out that we strengthen this capacity to handle this and we efficiently carry out the activity if they arises, I think it will build that confidence from the stakeholders. And by building that confidence, that means people will build confidence in even the whole health insurance ecosystem. Even for those that are outside, now they can be confident to say, even if I participate in these programs, that means that if an issue occurred, they will not only leave me on my own, but at least I have a place where I will go and cry, they will listen to me, and then they will also address my issue.
Welcome back from that break. The enrollee is a very important stakeholder in the entire NHIS scheme. It is safe to say that his level of satisfaction with the services provided by the NHIS is a yardstick that can be used to measure the success of the scheme. Drawing from our previous segment on the redress mechanism of the NHIS, we bring you the stories of some enrollees who have had to seek redress and their experiences. We will start with the case of Esther Shipade, who had a problem with her HMO. The NHIS helped her resolve the matter.
I went to the hospital, they wrote the injection for us. So the hospital, they don't have it. So we called the HMO, we went there. Actually, we went to the office. They told me that I should go and purchase the drug, I should bring the receipt and the letter, which I did. So when they refund the money, it's not up to the money that they're supposed to refund. So now I took the letter up with the head office now, and they work on it, and my money, the remaining balance, was recovered for me.
Lucy Imokalu is another enrollee that sought redress from the NHIS. Her money was refunded when she needed it the most.
Some time ago, around 2019, I went to the hospital and I was told that I cannot access my treatment because my HMO has not paid. So due to the nature of what took me there, I cannot go home with that medication. So I have to pay from my pocket, and I received the medication. So when I came back to my office, I reported the matter to my person in charge of NHIS in my office. So I took it to our director. So the money was not much, but due to what happened to me that took me to the hospital, because I fell down in the office here, I was carried to the hospital. So that is why my director insisted that that money must be refunded, because she knows that my office has paid. So they now took the matter to NHIS office, and it was followed up. Sometime last year during the lockdown, the money came to me and it was a surprise to me because that period, you know what was happening, what money was not at hand. Even though it was little, when it came, it was as if I received a million.
For Ene David Adiku, she was pregnant, in need of care, but didn't get it. Her story is interesting.
When I went to labor, and the doctor just came and said that they cannot take NHIS for delivery. Like, we even thought it was going to be normal delivery, but later on it even lead to CX. So we're like, Haba, we've been here for some months now, and you did not bring this out. So what is going on? Why is it now that you're just telling us that I'm in labor? So the man said that the payment is always delayed. I said, Haba, but even if it delays, they are still going to pay. And it's our right. It's been taken from my husband's salary. So why is all this now? He said, yes, that he's not going to take it. I said, my husband didn't even know what to do. He had to just accept and say, okay. So I went to the labor. After everything, the struggling, I couldn't even give birth myself. We have to go through CS. I was like, Hobby, how are we going to pay this money since NHIS is not going to cover it? He said, don't worry, let me just be okay first. So when we gave birth, they had to, from the hospital, they forced us to pay the money, which is about 200,000. And so we paid the money. When we came back, my husband was like, since they are taking this money from his salary, he has to write a report. I said, is this going to work? Are you sure? We're in Nigeria, I don't think it's going to work. I was even doubting him. So he said, okay, that you should give it a try. So he wrote the letter, and behold, like they paid us some money back, over 100 and something thousand. I was like, wow, is this true? So I was very happy.
Shitu Shehu Babatunde had an accident. He spent about 2 weeks in a hospital that was not his primary provider.
While we were in the hospital, all expenses were paid out of pocket. After I was discharged from the hospital, my friend, a colleague in the office, made the move. He started the move for me. Yeah, he applied for everything, and the desk officer in my office has been following up. And there's one Ajia Fati in NHIS. She took the matter on her head very seriously. She has been calling me, going up and down, till the day I was finally settled.
For Okechi Lillian, she refused to be discouraged when she sought redress for the money she spent for emergency surgery for her daughter.
I wrote to NHIS on the 31st of April. 1 week after my letter, I got a call that I wrote so later, I say yes. So after that, I started getting calls from the hospital, from my HMO. So with that, I was like, okay, that means my letter has gone far. I was happy. They were just calling me. If there's any information they need, the NHIS, they will call me, I'll give them the information. They will just tell me that I shouldn't worry, they are on my case. And it kept going like that. I was happy because I was getting calls. So it made me, it assured me that my letter was on. So with that, after some time, we met with the parties involved, my HMO and the hospital, and it was resolved. And I was refunded my money. My money was refunded to me.
There are more of such stories of enrollees who have sought redress and have been pleasantly surprised that the scheme stood by its core values. And that is what the NHIS is all about. For now, let's take your question answered. Do stay tuned.
Where do I register? How can I get enrolled?
Where do I register?
How can I get enrolled?
How can I get enrolled?
Question: what happens to a member's contribution if he or she does not access healthcare services under the NHIS?
Yeah, so that's the principle of health insurance and the principle of solidarity. The idea is that the money that you have on your own may not be enough to provide you medical services. So what you do is you pool that money together. So for those who are not sick within that period, they are contributing to the wellness of their brothers, their neighbors, and to ensure that those ones are able to access care for today. So tomorrow, when they will need care, and when I say care, is total care, could be preventive care, it could be curative care, it could be promotive care. So if they need that, they can then access it that month, with the hope that those who access it earlier might not need it at that particular time. So that is solidarity between contributors.
Where do I register? How can I get enrolled?
Where do I register?
How can I get enrolled? How can I get enrolled?
On that note, we end this episode of Easy Access to Healthcare for All Nigerians. If you are not a government enrollee registered on the NHIS platform, take advantage of the gift ship product of the scheme and get you and your family enrolled to access prepaid healthcare services. It's one sure way to avoid out-of-pocket expenses for healthcare and give yourself peace of mind. See you next week.